Hello and welcome to Conquer Eczema and Psoriasis the Natural Way with me, Dr. Irene Prantalos. Today I'm going to go through various ways we can improve our skin health through diet, lifestyle, and various other ways as well. It might be beneficial to just mute your connection just in case there's any background noise, and it can be a little bit disruptive if possible. Okay. So, okay. Now, do you ever feel tired that you've tried everything and nothing really works, or little effect from what you've tried? Have you spent lots of money in creams and ointments and feel there's been no relief from these creams? And have you been on a roller coaster ride with getting better, worse, getting better and worse, and so forth? So, just admitting another person. So, the reason why I ask these questions is because they were very much my situation, and I felt that all these things, and a lot of my patients do as well. So what if I could tell you that we could manage our skin issues with various ways and change these circumstances so we have much more control over our situation? Okay. Now, today I want to go through a little bit about my experience so you can understand where I'm coming from, what psoriasis is, what eczema is. There's a 5-step process I usually take with my patients to have healthier skin, and I'll go through that. So the benefits of the 5 steps and each of those steps. So doing a cleanse, the nutrition, positive mindset, targeted treatment, what your targeted treatment needs to be actually targeting, and shopping to support psoriasis as well. Now, psoriasis and eczema, of course. I'll go through some case studies and go through various other things, some frequently asked questions I have patients ask me as well. So now, there's a little bit of noise, so I was just going to, okay, so this is my skin probably around 18, 19. I was first diagnosed with psoriasis at the age of 11. It wasn't like this. It just started off with a few spots, and gradually over a period of time became erythrodermic. So erythrodermic means it covers your entire body. I tried everything. I did a lot of Western medicine because that was kind of our first point of call to try, your cortisone cream. I was hospitalized twice over it. This was probably after the second visit. Tar baths, paraffin. I did methotrexate the second time I was in hospital. So I did all this sort of stuff until doctors basically said, there's nothing else we can do. We've exhausted all options and you kind of need to just figure it out and go somewhere else. So in 1994, I tried Chinese medicine. And as a result, within 2 months later, my skin healed. It didn't cure it. I'm not here to say there's a cure. When we have that genetic alteration to our body, it's all about targeting it and managing it. And people can get resolution over a period of time, but it's by no means you're saying you're cured, where you can just go back and doing what you do and then nothing's going to happen. Your body will respond the same way. So I decided to study Chinese medicine in 1995. Then I opened up private practice in 2003 and realized a lot of people actually had similar circumstances to me, because at the time I was very much told, you're very rare, we've never seen anything like this before, we don't know what to do with you. And then not necessarily the same extent of coverage people had, but pretty close. And these sort of methods were failing them. And so I kind of felt not necessarily as alone as I once felt, and realizing there is a bigger problem out there than I once thought when I was going through it. Okay, so let's go through what psoriasis is. Now, typically, we're told psoriasis is an autoimmune disease. And so with that being an autoimmune disease, it means our body is reacting, it's faulty, it's not working properly. But if we look at the triggers, basically the triggers lead to inflammation in the body. So triggers can be dietary, stress, infections, hormonal. There's various triggers, and each of us are quite different in what triggers the psoriasis. But essentially, all triggers will lead to inflammation, and then the inflammation causes the immune cells to overreact. So it's not that we need to target the immune system. The immune system is actually not doing anything wrong. It's saying, hey, there's inflammation, I'm going to react to it, so I can bring your awareness to it. But if we target the immune system, like a lot of immunosuppressants do, essentially what's happening is that we're getting a false sense of security. We're thinking, oh yeah, I can still eat this or do this and my skin's going to be fine. But in actual fact, when the drug no longer can control the immune system, then what leads is to the inflammation exacerbating, and then you go harder drugs, or if that's not possible, then they take you off all drugs and you're kind of left with this complete exacerbation of the condition. So my objective today is to focus on the triggers and the inflammation. So the immune cells encourage the skin to overproliferate, and then you get psoriasis. So as I said, treatment protocol is about identifying the triggers for each person. Everyone's different, and then eliminating them or reducing them to as much as we can, and then eliminating inflammation. So when we look at eczema, eczema and psoriasis do get grouped together often. And yes, they're both inflammatory skin conditions. So ultimately, eliminating inflammation is both important in both circumstances. The differences come down to the treatment. And even with later on when I do talk about treatment, even in psoriasis, you might have 5 different people with psoriasis, and they also will need different treatment. It's not a one blanket approach where every single person gets the same thing. Everyone needs to identify the manifestation of their circumstances and get a treatment accordingly. But when we're talking about nutrition and lifestyle and topical things, they can be utilized for both eczema and psoriasis. So we have the triggers. It is more commonly appreciated, especially by Western medicine, that there's more of a food correlation to eczema than psoriasis. I personally think there's scientific proof for both. So you've got the allergens and intolerance, stress and hormones that leads to the inflammatory chemicals getting released, which causes the eczema to present. So again, treatment protocol: eliminate triggers, eliminate inflammation. Now, this 5-step approach is really based on understanding that there's a multifaceted approach to treating skin issues. And in actual fact, that can be, encouraged in a lot of illnesses. But for today's purpose, we're talking about skin. And a lot of times I have patients come and say, I've done the diet thing, it didn't work, or I did Chinese medicine and it didn't work. It really is doing all pieces of the puzzle, ideally. You certainly don't have to do everything, because sometimes there might be several changes that need to happen. So you don't necessarily do everything at once, because it can be quite challenging and overwhelming. But every time you do make a change, you definitely do move forward to getting healthier looking skin. So the steps are: step 1 is cleanse. Step 2 is an anti-inflammatory diet. Step 3 is having a positive mindset. Step 4 is finding a targeted treatment. And step 5 is knowing what to buy to have healthier skin. So the benefits of this, following this sort of 5-step process, is you reduce inflammation in the body. You can prevent inflammation from entering the body, because that's another thing when you're treating these sort of conditions. We don't want inflammation entering the body, because it will negate the treatment that's trying to get rid of the inflammation. You can create a healthier digestive system, which we all know, the gut connection to the skin, and reduce the frequency and intensity of flare-up. So like I said, we're not saying there's a cure. I had a flare-up after I had my son 4 years ago, because I had episiotomy, which meant I was on tramadol and endone, and that caused a massive reaction to my skin. So, you don't want to change your genetics. There's a lot of biologics that are around that claim to alter genetics. You don't want to change because you don't know what other genetics are going to be messed around with. And there was a biologic that switched on the Alzheimer's gene. So people who didn't even know they had this gene, it was switching it on. So by no means are we trying to mess around with genetics. We're just trying to encourage a healthier environment for the body so that it doesn't display the eczema and psoriasis. So you have also enhanced well-being, you have increased energy. When your body's sick, it obviously utilizes all its energy to get better. So when you can alleviate that inflammation, the body has a lot more energy. You improve your mood. I certainly have an emotional response to having lesions come out. So you improve your mood, your sleep, and also improve your self-confidence. Now, the biggest thing I want to talk about with cleanse is that I don't really advocate, fasting or water. I've done a water cleanse, I've done a liquid cleanse, and yes, it did help the skin. I'm not saying it didn't, but as soon as I went back to eating, it came back. So starving the body from food can often lead you to go back to eating in a way that's probably not beneficial for you in the first place. So what I like to look at the cleanse as being a bridge between where you are now and where you perhaps need to be. So if we can encourage better dietary habits through a cleanse, that'll be much better than starving yourself or going on a water fast or liquid fast, and then you revert back to your coffee or alcohol or dairy or gluten or whatever it is that perhaps isn't ideal, because first of all, you're so hungry, so you're overindulged, and second of all, you haven't really learned anything in that cleanse. So my idea of cleansing and doing it for a week at least is enjoying anti-inflammatory foods, buying organic and biodynamic if possible. I know that some people find it challenging because of the finances, but there's organic stores around that are actually quite competitive. And I find don't buy organic from supermarkets. They're actually quite expensive. Try and support small business who have organic. They tend to be a lot more competitive. Plenty of filtered water. Dehydration leads to disease. Dehydration leads to inflammation. So having a lot of water is really important, and filtered water. There was a study I read, and I don't know how accurate it was, but they found Evian was actually quite beneficial for skin. But what I have under my sink is a reverse osmosis unit. So there's 5 filters, and it actually takes out fluoride. The reverse osmosis unit is the only filter that will get rid of fluoride, and I would encourage no fluoride if possible. Now, you could replace a meal with a vegetable juice. Now, be mindful, as a Chinese medicine practitioner, we're not really huge fans of raw and let me just allow someone to come in. We're not huge fans of raw cold food because that does injure your digestive system. So if you're actually finding you have weak digestion, then you might find that your skin gets worse. And that's been a classic reaction to, there was a big phase of the celery juice. I don't know if any of you tried it, but I was watching people, I follow some people that talk about their eczema or psoriasis, and some people were actually commenting that it was making their skin worse. So celery is actually a good thing to have, but if you're having copious amounts of cold raw vegetables, it's going to upset the spleen, upset the digestion, and upset the skin. Okay. And also incorporating a relaxation technique in your cleanse. That's all part of marrying up the detoxification process of what we're eating and detoxification process of the emotional impact it's having on the body. So, I was really good with eliminating foods. I had no emotional connection to any food, but you tell me not to stress, I had a bigger challenge there. So we all have our little things. Someone might say, you know what, I can do my yoga every day. I'm pretty calm, I'm relaxed, but I can't get rid of my coffee, or I can't get rid of, my toast or whatever it is. So we've all got our little things that we enjoy or perhaps find it challenging to change, but it's a work in progress. We don't have to be perfect overnight. So step 2, when we're talking about nutrition, there's actually been, I get frustrated when I hear people say there's no scientific proof diet has any impact on psoriasis. It's actually been proven. There's research around insulin resistance. So anyone with over 3% of their body affected, which 3% is your palm. So any lesions that make up more than 3% of your body is you're likely of having insulin resistance. So that's one aspect of making sure you're having a certain anti-inflammatory diet. Healthy gut flora, that's where we try and introduce certain probiotics that are specific for the skin. The LGG strain is a good one for that. I'm not a huge fan of fermented foods, only because fermented foods grow yeast, and it is a natural form of yeast. But if you're going to react to yeast, you will react to fermented foods. And I've had patients in the past where they've been very healthy. They've done all the fads of fermented foods and chia seeds and all these sort of things. But you know what? In the end, their skin wasn't great. And that's because of various things we had to change. Chia seeds are not great for people with psoriasis, but flax seeds are. So there's these little things that, you know, we might think we're eating really healthy, but in actual fact, you know, it's not great for us. So leaky gut syndrome, I'm not sure if you've heard of it, but it's a term that's actually been linked to a lot of illnesses. Basically, it means the small intestine has become affected by inflammatory foods or other things, medications, stress, and become porous, which means that it becomes holy and it allows unmetabolized toxins to enter the bloodstream. So we don't want these toxins entering the bloodstream. We want them eliminated through the large intestine. But if this is happening, that is your immune system reacting to these pathogens. So when you're saying, oh, immune system's faulty and it's reacting to nothing, it is reacting to something. So first thing you have to understand is your immune system, and especially in this day and age where we're talking about COVID-19 and the immune system, have faith in your immune system. It is absolutely a powerful system and it comes across pathogens every moment of every single day. But if it can't do anything about it, if it's overwhelmed because there's this influx of unmetabolized toxins entering, it'll start instigating a massive immune response, which then leads to a number of things. So with us, we have skin sensitivities, it can be skin problems, sometimes it can be emotional, headaches, you know, the long list of things that it can create is pretty intense. Now, the other thing is gluten. Gluten increases insulin resistance. So if you've got psoriasis and over 3% of your body affected, gluten is definitely something you should avoid. And it's also been scientifically proven to increase inflammation. So when we're talking about taking away inflammation from our diet, we want to take away anything that increases inflammation. So we don't need to go to the extent of, say, a celiac where benches have to be completely free of not even a speck of bread. I'm pretty sure if you eat like a little speck of bread, it's not going to create a problem. But it is overall something you need to look at avoiding for the long term. So a lot of, obviously, breads and stuff have gluten. Be mindful of eating a gluten-free bread. Usually is packed with other things that you can't have. I have struggled to find a bread that I didn't react to. Even when I was doing the cookbook with my mum many years ago, we made many different variations and my skin was flaring up every moment. It was very tough. And then I just threw the towel and I said, there's no bread in this cookbook. I just couldn't do it. So it's a challenge, and eating, if you like bread, it's going to be a challenge, but I will probably try and find something else. I you know, as you saw pictures, I eat turkey and kale for breakfast. I had kale today. I can't have many carbs, especially refined ones, which are usually your breakfast cereals. I have brown rice and I have lots of soups and stuff which have brown rice in it, and I'm fine. But if I eat white rice or potato, my joints start to hurt. So there's definitely an insulin issue that increases the inflammation, and also there's gluten issue as well. Okay, so what should we exclude? The list is long, but you know, when you actually look at it, you know, the objective is to have fresh. So you know, refined foods are out. You could try like your brown rice pasta. There's different quinoa pasta. Some people say quinoa does affect them. I've got a patient with eczema who he said he tried quinoa, but he wasn't sure of whether it was a brand. So you need to be mindful. Your breads, as we said, gluten, yeast. So again, with fermented foods, be mindful of that. If you're saying, I'm having my fermented foods and for some reason my skin looks red today, we'll just maybe take that out and see if that's a factor. Dairy products, very, very inflammatory. Alcohol, inflammatory. Processed foods and canned vegetables. I prefer you to have fresh fish, fresh vegetables. And there's also canned chicken, which I didn't know about. But fresh is always the best. Then you know how long it's been around for. Okay, now spicy hot food is not a good thing. Now this is an interesting one. Now I've had a patient who was half Sri Lankan, and she had psoriasis, and whenever she went to visit her dad, he would make a spicy meal because that was part of their cuisine, and she didn't react. But if she did it a lot, then she would notice her psoriasis get worse. So it's also one thing we have to look at our heritage. You know, mine's a Mediterranean background. She was a Sri Lankan background. Your ancestors dictate what your body can tolerate. So, and I've got another patient, she's Sri Lankan, and she can have amaranth flour. If I have amaranth flour, I flare up. And on the flip side of that, she told me when she had amaranth flour in Australia, her skin would get worse. Whereas if she have it in Sri Lanka, her skin wasn't going to get worse. So I don't know how we do things here, but I have a lot of patients who have gluten intolerance, and they go to France and have bread and they're fine, and they eat bread here and they have massive reactions. So spicy hot food, not ideal. If you're a massive lover of it, what do I say? Have a truckload of water afterwards. I don't know. Dandelion tea. Dandelion takes away inflammation. Or just slowly reduce it and maybe change your taste buds. Now, fatty food is inflammatory. Animal fats are inflammatory. So when I talk about red meat, I don't eat beef, I eat lamb. And I do it seldom. I only do it maybe once or twice a month. And the only part of the lamb I have are the fillets. So they're like literally free of any fat. If I have a lamb roast, I don't have a reaction from the skin, but I feel uncomfortable. I get chills. That's my little indicator that my body didn't like what I ate. I get really cold and just feel quite off. So animal fat's not great. Fried greasy foods aren't great. Some meats, pork, bacon, beef, like I said. Red meat essentially is inflammatory, but it's believed that beef is more inflammatory than lamb. Deli meats, all that preserved food, you know, they've got a lot of stuff in it. You want to have fresh food. You don't want to have anything preserved. Shellfish. And the reason why shellfish is because the shell actually keeps the lead inside the actual crustacean. Is that what it's called? I'm not very versed in this sort of thing. So with other fish, it is able to be excreted, but with shellfish, it contains inside. So that's why we say no shellfish. Excessive quantities of carbohydrates, spices. So one thing with the insulin resistance, having a lot of low GI carbs is just as bad as having high GI carbs, because the body has to process that large quantity. So I typically put my patients on an insulin resistance diet, which can help reduce inflammation. Okay, so what do we include? You're probably saying there's not much left, but there is. All your green leafy vegetables, your detoxifying vegetables, your beetroot, broccoli sprouts. Beetroot does have a laxative effect, so be mindful of stools and urine changing to pink, red color, and also maybe making stools loose. Now, we never want our stools loose. Loose stools mean we are losing our nutrients through our bowel. We want to have healthy stools. And if anything's causing you to have loose stools, then you need to change it, reduce it, take it out, whatever it is. Our stools are a massive indication of what health our digestion's in. Now, as I said, with lamb, chicken, turkey, turkey is white meat, and wild ocean fish, much better than having farmed fish are fed pellets. And sometimes you can react to what they're fed and not the actual fish. I know that I feel a little bit off when I eat farmed salmon, but if I have wild salmon, I'm fine. So salmon is great. Salmon is a great fish to have. It's huge amounts of essential fatty acids, but the massive problem is it's farmed. And if you can find wild or organic, sometimes the organic is still farmed, but it's given different food, but it's like $18. I did try, I'm very reluctant to buy things from supermarkets, but my mum bought me yesterday, she bought John West wild Atlantic salmon, and I was very reluctant because last time I ate anything from Coles, I had the loose stools. And I was like, all right, I'm going to open it and smell it. I can usually smell if something's not right. I thought, okay, it doesn't smell, which is really good for fish. I'm just hoping they didn't put any preservatives on it. And I cooked it and it was fine. Didn't get a headache. Didn't have a digestive reaction. So maybe you can find the John West one. My mum said it was $15 for 2 pieces. So it's quite expensive. Herbs, I prefer herbs that are fresh. It's really easy to grow a little herb garden. Don't need much space. I'm saying this from the apparent sense. I don't do it. My mum does it. So I'm a bit cheeky and get it all from my mum. But many people who do gardening say it's very easy. And sea salt, I really prefer people to have Celtic sea salt, Himalayan pink salt. Don't use the table salt, that's toxic. It's just sodium chloride, not great for us. And using extra virgin olive oil. You can also have coconut oil, but I prefer not to actually add the oil until I've done the cooking because of can change its molecular structure and become a little toxic. And then again, your water, 2 to 3 litres of water a day. If you're not drinking 2 litres, start slowly. Don't impact your kidneys by having too much too quick. And what I usually say to people is 1 glass every hour. If you, and I'm putting my hand to this because I've done this and that's why I'm saying it, you know, a lot of things that I identifying that are wrong, it's because I've done them. End of the day, oh my gosh, drank no water, grab a big glass or grab a 500 ml bottle, guzzle that down. Your kidneys need to filtrate all that water in that moment that it's consumed, which is a massive strain on the kidneys. So really important to just drink over, sipping through the day is ideal. Okay, so step 3 is positive mindset. Now, negative emotions lead to skin issues, well, lead to disease. I personally think most diseases, 99% of them are really made from stress and emotional stress and so forth. Then having the actual illness can perpetuate stress too. So it's very challenging when you're going through ill health and, you know, you're told don't be stressed, be positive, and you look at your body or you feel uncomfortable or you're feeling quite devastated with what you're dealing with. I've had lots of patients where they've got massive plaques all over their body, and personally knowing how can they move freely, how can you be positive every time you're walking, you're feeling pain. So it's really challenging to override the experience by being positive, but it's finding ways to introduce positive moments in the day that can potentially break that up for you a little bit. So what I mean by that is having supportive people around you. I had lots of friends visit me when I was in those moments of being bedridden, and you know, you don't forget what's going on, but for half an hour, you have a bit of a chat, you talk about what's going on, take your mind off your issues, and have an enjoyable conversation. Having people understand that you're limited in what you can do, perhaps you know, moving freely, playing sport, whatever it is. You know, having people understand and empathize, but not pity you. It's really important, if you are someone who cares for someone who has this, it's very important to not pity them, because in that instant moment of pitying someone, you're taking their power away. So being empathetic and supportive is one thing, but really encouraging them to take control of the circumstances and do the things that are needed to be better is what that person needs. When people pitied me, it really disempowered me in a very quick moment, and I hated it. Celebrating wins. I know looking at your skin and assessing it on a daily basis is not ideal. Been there, done that, not great, can make you a little bit nuts. But little things where that might happen, not necessarily related to your skin, but in your life in general. You know, you could have watched a video that was really empowering, or read a book or something that was enjoyable, had a great chat with someone. Something is really important to celebrate these wins in your life, having gratitude as well. So what I used to do before I had my son, and I'm really trying to get back to it daily, but it's not a daily practice as yet, is reading a positive self-help book every morning for 20 to 30 minutes. It doesn't have to be hours on end, but if it's that 20, 30 minutes, it does get your day on a better mindset than if you didn't do it. And it's really important to read a positive self-help book that resonates with you. There's various famous people that I thought, oh, I can't wait to read this book. And there was an Eckhart Tolle book that I literally got migraines from, and I don't even get migraines. And I don't know why, but my brain was struggling to process the words he was saying. And maybe in my journey, I wasn't ready to hear what he was saying. And I eventually put it away and thought, I just don't think this book is right for me. Then I picked up another book, was actually on autoimmune diseases. And when I was reading it, it felt to me the author was pretty pissed off when she was writing this book. And I'm like, no, that's not the energy I want. So again, I put that book down, and then I found another book. So if the book doesn't resonate with you, it either means it's not the right message right now, or you don't need it. So just trial different things. Everyone is in a different place in their journey. So finding out where you are and finding something that resonates with you is really important. And meditating and positive visualization. I always visualized having healthy skin, and you know, meditating and getting into that calm state, it was pretty important, especially in the most challenging times. And these are challenging times now, and this is how you can lift yourself out of the negativity of what's going on, trying to keep yourself in a positive mindset. Okay, so we're coming to targeted treatments. There are many treatments around, and I personally think I've tried everything. And, you know, like I said earlier on, this is just my opinion, and by no means am I telling anyone what to do or not to do, but anything that suppresses your immune system is going to cause a cascade of problems later on. And one of the reasons is these two diseases are both linked to other illnesses. So let's take psoriasis. Obviously, I know psoriasis inside out. Psoriasis has been linked to metabolic syndrome, which means that it can lead to diabetes, heart disease, and stroke. So one of my patients who I met, because her doctors took her off her medication because she was she had liver damage as a result of the medication. And she literally followed the protocol of what happened. She had diabetes, she had a stroke, and she was on medication for heart disease. And so it's not just a skin issue. When we're saying skin problems, it is not just a skin issue. This inflammation is impacting all the cells in the body. And so if we can eliminate this inflammation, it's not just to help the skin, it's to help the progression of this illness later on. And when we're distracted by suppressing the immune system, what's actually happening is we're getting a false sense of security, and we're doing what actually our body doesn't need because we don't think it's having an impact. If you're currently on medications, what I usually do with patients, I always keep them on. It's not under my job description to take them off. I'm not allowed to, even if I wanted to. But the objective for me is because people that are on medications will only come and see me when it's not actually working. So what you try and do is treat them in a most effective way to have their body get better, even while they're on the medication, and then hopefully their dermatologist gradually takes them off. So my opinion is treatments always need to focus on eliminating the triggers. And when you eliminate triggers, you're eliminating the potential of inflammation entering the body, and then you're eliminating the inflammation that's already there. So you're also taking that away. If you're not eliminating triggers and you just, let's just say Chinese herbs, and you're eliminating the inflammation, that's great, right? But it's completely negating. So it's cancelling off one another. So you're having inflammation come in with the triggers and coming out because of herbs, that's what they're doing, and you stay exactly where you are. So it's really important to make sure we do both aspects at the same time. And sometimes people aren't fully aware of their triggers, so I get them to keep a journal for me. Okay, so step 5, shopping for healthy skin. Now, basically, you know, the great thing with skin problems is that you will pretty much know fairly early on when something's not right, whether you've put it on your skin or clothing. You know, clothing's a big one because, you know, nice soft cotton is always the best and most gentle on the skin. You know, the nylon and synthetics can actually cause little micro tears or traumas to the skin, and so what happens is your body gets hot and gets irritated and you want to scratch. So when you wear clothing that irritates you, maybe you have to for work, you know, hopefully maybe if it's a top that's nylon, maybe put a cotton top underneath that the skin has got exposure only to the cotton and not the nylon. But clothing is a huge one. Linen is also great because it's natural, but linen's very hard and still can be uncomfortable if the lesions are quite thick and inflamed. So I always recommend organic over non-organic, fresh produce, but whatever you can, even if it's 80% organic, that's something much better. Now, the biggest issue we have with our fresh produce, apart from organic versus non-organic, but it's the fact that everything's picked green. And when things are picked green, we're not getting the maximum nutrition in it. Look, for instance, broccoli, as soon as you cut broccoli, you have 7 days to eat it before the vitamin C is out of that broccoli, whether it's organic or not. So ideally, if we're in isolation, as some of us are, looking into creating a veggie patch, you are literally eating things organic, and you're also eating things when they're ripened, which is what the actual nutritional value is. That's why sometimes I need to put patients on supplements, because even though they might be eating organic, they're sorry, I'm echoing, I think. They're not finding that they're getting the nutrition from it. Okay. Now, skincare. Now, using any type of skincare for our skin, whether it's just for beauty or if it's for treating the ailments, that's something that it's best to choose something that doesn't have any nasties in it. And makeup, same thing. Personal care, or we have to eliminate all the nasties. Household cleaning products are also pretty important. What you wash with is very important, because obviously you're sleeping in the sheets that have those chemicals in it. You know, you're cleaning toilets or showers and you're inhaling that. All that sort of thing is pretty important to try and find good cleaning products, or you can make them at home as well. Okay. Now, I just wanted to talk about some case studies, because sometimes people want to know, you know, how does it work if they do get treatment for their skin issue. So this is a gentleman who it's hard to see on here, but on the left side, you know, the skin's quite thick. Even though it's pale, it's very dry. The legs were a lot worse, but the right side I took when he came in to collect some herbs, and he was like, oh, my skin's really good. Look at it. And he showed me his arm. I was like, okay, I might take a photo of it. So he showed me his legs, but I didn't want to, you know, bombard him. I'll bombard him next time he comes for a treatment. So basically the right side, you can see the skin has thinned out. So really when it comes to psoriasis, we need to take the inflammation out, and then the immune system stops reacting to the inflammation, and then you get the skin slowly shedding. So really the body is healthier on the inside before it shows on the outside, and that's why it can take a period of 3 to 6 months before you see much changes. Oops. Now this patient, I actually had their wife email me, only because she wanted a treatment for herself. But he's had eczema for 30 years. He's tried everything. He's tried Chinese medicine in the past as well. And they did mention that when he was on that, it helped. But he would spend a lot of time in the bath to alleviate the pain and itch he was in. And his wife was saying he's not doing that as much. This was just after the first consultation and probably a few weeks into taking the herbs. That's the one thing for eczema sufferers. Eczema is a lot easier to treat. I've done practitioner seminars for the last couple of years. And one thing that we all agree on, psoriasis is a much more challenging illness to treat. You see the results of eczema a lot quicker before you see psoriasis. So this patient is an eczema patient who is, his wife is emailing me after the first treatment. And this patient is someone who I'd seen for well over a year before she gave me this update. Now, she was coming into my clinic, but she was living, it would usually take her a couple of hours to get into the clinic. So after a period of time, we tried to manage things, and we were doing it through Zoom. And so basically the first thing was for her that resolved was a psoriatic arthritis. And she did come in saying she had psoriatic arthritis and psoriasis. And she did come in saying the psoriatic arthritis is much more of an issue for her. And that is what I focused on. Even though the difference is inflammation in the joints versus the skin, the herbs are very different. So to treat both is challenging. It means you reduce the effectiveness of the herbs and you don't get the resolution as quick. But that was her choice. Other people say the other way around, so it really depends on where you're at. But she was losing weight because we took inflammation out. So if you think your body is inflamed, it gathers all the white blood cells there, and so you get fluidity, you get fluid retention. You're always going to increase a few kilos when you actually are inflamed. I always did as well. And then as soon as the skin resolved, then the inflammation was gone, obviously, and weight loss happened. I think she was eating better. That's why she got the 8 kilos. That's one thing I need to be mindful of when I'm treating someone who's very lean, because they actually are, I need to be mindful of not them losing any more weight, because it can happen. Okay, so I wanted to talk a little bit about, the mindset around illness, because a lot of times, it's very confronting and no one wants to be sick. It really is not a nice place to be when you're not well. And it's only in these times that we reassess what we're doing and we need to make changes. If we don't make any changes, then nothing's going to happen. So in a way, illness can be a blessing. I certainly didn't think that when I was sick, but now that I'm over that challenge, it has created many improvements in my health, my mindset, the way I look at the human body, the way I look at choices that I make for my son. He eats all organic. I don't eat sugar. So he doesn't actually like sugar, because I didn't have sugar when I was when I was pregnant rather. So he doesn't like sugar. Everything can impact our lives and the people around us from what we're experiencing. So it doesn't need to be seen as a negative, but something that we can actually learn from. And the one thing that I always hear about, and I said this a lot too, we kind of have this metaphor of war when we're fighting something that's not right with our health. You know, cancer gets a lot of this. You know, I'm gonna beat it. You know, I won't give up. You know, I won't let it defeat me. And cancer is really just immature cells in the body. They're not mature enough to function, and so the body starts breaking down. So if we're fighting ourselves, what sort of mentality is that? Especially with an autoimmune disease, the last thing we need to be doing is fighting or disliking ourselves. And that's what happens with skin issues. We look at ourselves a lot, and this happens with acne as well, where you look at yourself in the mirror and you don't like what you see, or you look at your body, you don't like what you're seeing, and you have this dislike to yourself. So accepting it eliminates the inflammation. When you can eliminate this whole war between yourself and the disease, really, you surrender, and then your body can heal. Your body's always healing. Your body is always trying to be healthy, and it just sometimes needs a bit of help. Sometimes it gets overwhelmed, and so if we can encourage it to heal the way it knows to heal, then illness resolves. Like I said, it's not a cure, but we need to just adopt that mindset. Okay, so here are some common questions I get asked especially when I talk about diet, because I think people always ask, well, I need to do this forever. And I always say, well, forever is a long time. How about we just start with 6 weeks or 8 weeks? And, I'll give you a bit of a cheeky reason. It actually takes 6 weeks to adjust to a new diet or new habit. And that's why I tell them, because what ends up happening is when people start feeling good and you take all that inflammatory stuff out of their body, they start being happier, they feel better, and they actually don't want to revert back to the old ways. So no, not necessarily need to do it forever, but you will want to do it forever, because I it's a no-brainer for me. I'm never even challenged by eating anything I can't eat, because I want to feel healthy. I want to wear a t-shirt if it's a hot day, or I want to go to the gym if I feel like having a workout. Not now because they're closed, but all these sort of decisions that we can make when we feel healthier is suddenly there for us to make when we're doing the right thing. Now, some people will say, I've been following the diet, but I haven't noticed any change. Now, it's really important to understand that with skin issues, and this is more psoriasis, eczema, like I said, is much easier to treat, and you see the improvements happen a lot quicker. With psoriasis, is the body needs to heal before it reflects on the skin. So it can be quite challenging, where you think you're doing all the right things and you're ticking all the boxes, and I'm doing everything she said, and I just don't, my skin's not changing. It takes a time for it to translate to the skin, and that's where it's really important to understand, to give your body that time. Now, there are ways you can speed it up. One way, and I don't know where everyone lives, but if you've got the beach nearby, that's a fantastic way to take that inflammation out of the skin. The sea and the sun, especially with psoriasis, as long as it's clean water, it's not polluted, and don't stay in the sun for too long, because you're going to burn, and that's going to create more problems. That will make things speed up. And there's a lot of other things you can do as well. Some people find it challenging to give things up. I can't give up alcohol, I can't give up smoking, or I can't give up coffee. And we kind of work with what's important. So, I usually ask people, out of all these 4 things, what's the one that you could give up? And that's where you're going to start. You're going to start with, what's one thing that I can actually not have and I'm okay with? I had a patient who came for foot problems, actually not a skin-related issue, but she would have a block of Cadbury chocolate a day, and she was having 2 glasses of wine. And I said to her, one thing I've got an issue with is you eating Cadbury, Kellogg's, Nestle. Crap, don't eat them. They're just rubbish food. If you're going to eat chocolate, this is 2020. We have so many companies that are bringing out good, ethical products. But what she did, the next time I saw her, she goes, I just stopped it, cold turkey. And I go, what about the wine? She goes, no, I haven't stopped the wine, but I've stopped the chocolate. And this is a lady who'd been doing it for 3 decades at least. And this is someone who's actually climbed to the base camp of Mount Everest. So she was very much healthy. She was a very lean person because she did so much exercise, but I was concerned that the Cadbury chocolate was causing inflammation, which was causing the problem in her feet. And that's where, you know, if you can write down things that you think you need to improve on, start with one that you find is not an issue and work your way down. Now, if you are using cortisone actually exacerbates skin issues. And so it's really important to understand that what are we treating and what results do we want? If you're going to stop your cortisone, you are going to get a reaction. There's no way you can change that. So what I usually say to people is to wean off it. You know, maybe use it once every 3 days. But you will get it. It's almost like what I experienced was the disease became a dragon in a dungeon, and when I stopped the cortisone, this dragon just came out, and the skin always exacerbated a lot worse than what it was prior to me starting the cortisone. So it's really important for you to gradually get off that at some stage. Now, biologics get a lot of discussion. I'm not sure if you have heard of biologics, but certainly in Melbourne, I hear about this a lot. And listen, I'll put my hand up and say, inject me with something that cures my disease. I will take it. But these biologics have so many side effects. You're literally injecting like Russian roulette. It is, there's so many things. First of all, they're fairly new drugs. Don't ever take a drug that hasn't been tested on people for at least 10 years because you have no idea what the side effects are. And the second thing is it's not making you, or it's not allowing you to treat the illness. You know, you're looking at your body as being a nuisance, and this disease is presented, and let me just shoo it away, really takes away the reason why the disease is there in the first place. And so I went and had a mole checked, and this GP was just so interested in the fact of how I treated or maintained my skin, and didn't choose to use anything. And I said, listen, I would love something that got rid of this forever, and I could go and try and eat this or that and the other. But I said the side effects are too great. And he goes, you're right, the side effects are bad. But, you know, as doctors, we don't have anything else to give patients. And I said, well, there are other options. And he was certainly someone who was open to looking at natural therapies and wanting to actually get into integrated medicine, which was really nice to hear. So finally, a question I get a lot, people ask is, will my child have this? That's something I was actually very nervous about. Genetics is what it is. We all have genetics in our body, and we don't know if we give it the right environment, they switch on. And really it's about keeping your kids healthy, you know, having low inflammation in their diet and in their lifestyle as well, teaching them to live in a way that creates a more alkaline body, encouraging them to exercise and to drink lots of water. My little boy hates anything fruit juice. He doesn't have any of that. He just drinks water and chamomile tea. And that's just because of what I've encouraged him to eat from the time he was a baby. So, you know, you can kind of, obviously, I know he's going to become a teenager and probably love Maccas, but I'm hoping I've you know, created taste buds to the point that I can, you know, hope it doesn't happen. But if it does, I just have to let it roll. But that's basically what you can try and do with your children. Okay, so now for anyone interested in treating their condition, I wanted to let you know that I will answer that question in a second. I do see patients in clinic still as AHPRA registered practitioners. We're part of the essential businesses, so we're still open. Also do Zoom consults for anyone who either is not local or prefers not to venture out of their house. So we discuss basically what I need to understand is how the disease is manifested. So I ask a lot of questions around past history and current history, medications taken, and symptoms that are present in a systemic presence, because the entire body is showing signs. Even if you don't think it is, it does. And then we work out a treatment protocol. And if it's an online consultation, then I send it out to you. And I've got patients all over Australia because, you know, it's really tough to treat these illnesses. So they take their herbs and supplements and so forth. Also, what I usually do is give people free access to our online program. So that online program goes through, so you receive 8 weeks of food. It's not enough food, sorry. A menu plan, shopping list and a menu plan. Goes through, you can download the meditation CD, all those 5 elements, except for the treatment, of course. But all those other steps, it gives you a step-by-step process to go through it. So the cleanse, and then the food, positive mindset. I do talk about different treatments, because there's lots of different treatments out there, and give my opinion on the various treatments. And perhaps sometimes we need a collective treatment. So, you might do kinesiology and herbal medicine, or you might see a naturopath and get supplements, and Chinese medicine for herbs, whatever it is. So that can certainly help with collaborating a couple of therapies together to get the results you want. And I go through that, and then obviously shopping for psoriasis and eczema. Now, the online course is called 5 Steps to Target and Manage Psoriasis. But like I said to you, we're really, what it really should be called is eliminating inflammation in your diet and lifestyle, because that's what we're doing. When I said these 2 illnesses need to be individually addressed, it's when we're talking about treatment. Sorry. Okay, so that's a 5-step process. You got weekly shopping lists, motivational videos, guided meditation. Obviously, you can always reach out to me. You can do that anyway. You don't need to be in the program. You can certainly feel like if you've got any questions, you can definitely reach out. So the benefits of this 5-step process: reducing inflammation, healthier skin and joints, improving energy and well-being, and mood and sleep, because all that impacts your skin health. And you do get weight loss, reduce sugar cravings, and definitely have more excitement around life once we get out of this lockdown, that's for sure. Okay, so now I'm going to open up questions. Okay, so could you tell me if it's eczema or psoriasis, Melinda? Psoriasis. And are you breastfeeding, or are you introducing foods? Okay, so alrighty. So when we're talking about psoriasis, patients, if little ones are, so if they're being breastfed, I usually treat through their mum. So I actually encourage them to eat a certain way and treat the psoriasis that way. But if he's having foods, then I definitely see the problem is when you puree like apples and stuff, it's a lot of sugar, and that can irritate the skin. I'd probably be looking at his gut health. I think that you can actually treat effectively just with probiotics because they're so little. And sometimes some cream. I give the revitalizing scalp and body cream. Okay. So with the formula, okay, so he's on formula. I guess just kind of knowing a backstory, when did the psoriasis start? Did that start at what stage? Do you mind if I unmute you? That way we can have a conversation. Okay. All right. So said yeah. Okay. All right. So when did the psoriasis start?
Can you hear me?
Yeah, I can hear you.
Good. So I suffer from psoriasis myself.
Okay.
It comes from my mum's family side.
Okay.
And when I was pregnant with him, I was pretty much up to one stage about 70% covered with psoriasis.
Okay.
And just after I had him, I was then diagnosed with psoriatic arthritis as well.
Okay.
I started noticing probably about 2.5 months. When he was about 2.5 months, I started to notice he had a little bit of a dry patch in his ear, and I kind of, I suppose, hoped it wasn't psoriasis.
Yeah.
But now, I continue to notice a little patch when he started crawling around, like it's not healing, it's not going away, and
Yeah.
it's starting to become a bit more drier and flakier. And his ears, like there's just these 2 patches in his ears just remained there.
Yeah.
And I put a little bit of zinc cream on there,
Okay.
but obviously they're not going away, and it is to me looking more and more like psoriasis.
Yeah. So, so definitely we want to, so obviously the inflammation was, so the poor little thing's got a little bit of inflammation, which is not your fault. It sounds like you're struggling a lot. And that's the interesting thing, isn't it? A lot of times doctors will say, because of the altered immune state, when you are, when you're pregnant, your skin gets better, but in actual fact, yours was clearly opposite. What I
It
would try and
was.
do, he's way too young for herbs and stuff, but there's a lot of other things. So I would try and introduce essential fatty acids. So like, I don't know, is he eating? He's not. See, when he gets a bit older, it might be a little bit easier. And just
Yeah.
foods that are high in zinc and stuff like that. So just try and do it with food. I think with sugar, like with pears and apples and stuff, because you're obviously pureeing, it might just be too sweet, and that might be a bit irritating. I don't know how good he is with eating. Does he eat well?
Yeah, he's actually not too bad. Like, saying about that, like I can give him a piece because he's teething. I can give him a piece of apple,
Yeah.
and he has been like, kind of chewing on that. So he is taking those smaller lumps at the moment.
Yeah. So I'd probably, I prefer to give him that, give him the apple versus pureeing it. Also probiotics, I would probably try, to be honest. I would try and just do it that way. If it doesn't resolve, really, I mean, because he's so little, you want to try and reduce inflammation as natural as possible. So I gave my little boy chamomile from the time he was very little, just because it helped with passing stools easier. Sometimes I felt like he was a bit constipated. So I wonder if you can try a little bit, just very mild, a little bit of dandelion tea or something, just a little bit, just so that, because obviously there's inflammation there, and it sounds pretty mild, but my first step would definitely be with probiotics, and then try and introduce, essential fatty acids and, foods high in zinc, and try and avoid the red meats, try and avoid anything that's processed, anything that's going to cause inflammation. So all the foods that I was going through that before, because the thing is that, you might be thinking, well, I want him to eat everything because I don't want him to be allergic to anything. But if his digestion isn't working well, then
He
he's
gets
going
a
to
bad
be,
reaction.
he's going to have food intolerances anyway. I've got a young boy, actually, he's coming this afternoon, and he's probably, I think he's 14, and he's just got the smallest patches, but as a baby he had a lot of digestive issues. And so in actual fact, I've treated his psoriasis with digestive herbs, which sounds really weird, but it actually precipitated from the digestion. So if you can just try and improve that, then, and I don't know what type of formula you're using, maybe, try maybe like a goat's milk one or something that my little boy, actually, I don't know I can't remember what age they start drinking actual cow's milk, but I give my little boy camel milk. And the reason being is, one, my paranoia of inflammatory foods, but camel milk has actually been proven to help with autism, and autism's believed to be an autoimmune disease and an inflammatory condition. So my mindset was like, hey, well, if autism has been proven to be helped by camel milk and it helps reduce inflammation and an autoimmune disease, well, why couldn't it help with eczema? Because he had a little bit of dryness on his cheeks, but I think that was actually from some homeopathics that I was giving him. And so when he's old enough, I would take him off the the formula.
Formula.
And like I said, I actually can't remember. I think the last 4 years are a blur for me. But put him on camel milk if you can. It is super expensive. It's like $10 a litre. But that is actually being proven to be anti-inflammatory, and that way he can still enjoy his milk. and see how you go. But definitely let's start with the gut health and try that way. And then from there, I think.
Is there a particular type of probiotic that you would recommend for someone so young?
So I just gave my little boy the Metagenics, the Flora Care for Kids. So you probably can get that from a pharmacy. So that's got the LGG strain. And LGG has been scientifically proven for eczema, but I still use it for my psoriasis patients. For my patients, I actually give them the immune control, the adults, but for children, I give them the Flora Care for Kids. And you can just put it in the formula. So I would just try and change his diet, put a natural cream that helps with moisturizing it, bathe him in, Celtic sea salt or the Himalayan pink salt. So you kind of try and treat it that way. And yeah, hopefully good, but you need to restore that gut health first.
Oh, thank you so much for your help there.
That's all right. All the best. Poor little thing.
Thank you.
You're welcome. And let me know how you go if you've got any questions as well.
I will do.
Okay, I'm just muting you now. Okay, so Tanya said about doing tests in regards to food sensitivities. So I went down this road a lot. I did loads of them with my naturopaths. I did the vegan machine. I did the desensitizing tests, so found what I was allergic to, and then did the desensitization both through drops under the tongue and with the injections, like the little injections, and none of that worked. So it does help from the perspective of, oh, okay, well, I've got that sensitivity, I shouldn't eat it. But the sensitivity is coming from the poor gut health and the inflammation in the body. So, the test, all pretty much, I've had patients do their tests, and I think we all say the same, like ryegrass, and there's, animals and dog fur and cat fur. I think they're very commonly irritating anyway. So you can do them. They're very pricey, but I wouldn't say, oh, okay, I won't eat this and that means I should be fine. That allergy or that sensitivity is coming because the digestion is reacting to the food. And so it's really important to, yes, avoid those triggers because that forms part of your triggers, but we need to heal the body so that there isn't that reaction. Not that you're going to go back to eating exactly, but like, for instance, I had the ryegrass. I can be in the house when my husband mows the lawn. I don't have a reaction. But way back when I was younger, yeah, my skin did go more red when my dad mowed the lawn, and I get itchy and I get frustrated because my body was so much more reactive. So from one perspective, yes, you can find out what the allergies are. From the other perspective, we still need to treat the gut health in order to minimize the reactivity to the sensitive foods or environmental factors so that the issue can be resolved and managed a lot better.
Can I just ask you, then, like, I have a naturopath that works in my clinic, and she's got like 500 tests that can, like, for other things too, like clothing or soaps and perfumes. Yeah. It's kind of like, because I think that, like, I developed eczema just in the past. I think I had it about 2 or 3 years ago, but all of a sudden I had like eczema again on my hands, and just my hands. And I'm like, okay, is it something? I know I've been stressed, so definitely I know that's a part of it. Yeah. But I'm like, do I pay all this money to see if this one of these 500 things on her test, or do I just do, like you said, like I'm like, it must have been something I'm washing my hands with.
I would look at what you're coming into when it's just hands, that's like something probably like a contact dermatitis or something. So one of my patients was bringing her little daughter in, and she just had a round circle on one hand, and we were trying to figure out what was it that she was reacting to? Like, I go, does she lean on the carpet at school with one hand? Like, what, we were literally, and then eventually she told me that, the teacher doesn't let her wash her hands before lunch. So I've given her an antibacterial sanitizer that she puts. And then we looked into the MI ingredient in these antibacterial sanitizers, and that causes eczema. As soon as you stopped it, the eczema went. So definitely look at what you're washing your hands with, any hand sanitizers. The MI is the one that causes eczema. And definitely now with overwashing, I've got natural Castile soap, and even my hands were turning red. So at night I put my cream on just before I go into bed, because I try and take that irritation, dryness out of my skin. But yeah, definitely look at what you're using first, because when it's hands, we always kind of think it's a contact dermatitis.
Yeah, well, that's what I mean, I know that tomato sauce and stuff will also trigger eczema for me in other places. But I've been doing definitely a lot more washing of the hands since this whole thing. But it did hit a little bit before that, and so
maybe it was something else triggered it to start with, and then it just exacerbated with the overly washing. And then couple that with stress. I've had patients that I haven't seen in a long time because their skin has been great, and they've come back saying their skin, psoriasis and eczema have gotten worse. So I think these times we're facing now, there's a fair bit of stress, and so that is always a good instigator of skin issues. So maybe trying to maybe put your hands in. I'm a big fan of putting the hands in salt water, or Celtic sea salt, or even colloidal oatmeal is good to take the itching out and the inflammation out. So try and do it topically, do some meditation, and then try and change what you're using for hand wash and sanitizer if you are using that, and see if that makes a difference. Because I think if it's just now, I think you might not find the answers, or you might find the answer, and then what, you still have to do the same thing. So
just quickly, I don't know if I should message you about it instead, but I use a lot of your products for my, for face and stuff, and I get your products for my kids. But I actually have been using it to calm the itchiness out of my hands. Do you have I know you have specific one for psoriasis, but do you have lotions that people can use to take away, the itch?
So what I hear a lot, the Salubria skin balm, a lot of people say it takes the itch out of their skin. But I've found the revitalizing scalp and body cream better for eczema in a general sense. If you buy the trial pack, you get both, and I guess you can trial both. But I found that the feedback I get. So with the revitalizing scalp and body cream, with what Melinda was saying, one of my patients, her little boy had eczema on his cheeks every night. She would put it on because he wouldn't let her put it on in the day, and he'd wake up and it was almost gone, and then he'd do whatever he did, and basically would come back, and so she'd keep applying it. So it does seem to have a good response for eczema. Whereas the balm, really, I did it for that, the thick plaque type psoriasis that really needs that extra hydration to allow for the elasticity in the skin for people to move around. So, but you kind of have to trial. But for the itch, a lot of people have said the balm has helped. But
great, thanks.
But I would definitely soak my hands in the salt water. I think that. And then you put the cream over it afterwards.
Okay.
Right. So that's what I would do. Yeah.
Thank you.
Okay. So now Melinda's saying, I'm currently in a flare stage with my psoriasis and psoriatic arthritis, but in the last week I started to have hives. They come and go in small patches. I have never had hives before. Is this due to inflammation in my body? From your range, what would be best tea for me at the moment in my scalp? Psoriasis, itchy. What's the best products? You know what, Melinda? I just feel like I want to throw you in the ocean. I think the ocean would be great for you. So the hives is coming from what we as Chinese medicine practitioners, we say wind, wind heat. Your body is struggling, and to simply say, you honestly, you probably need proper treatment from a practitioner, because you've got the psoriasis, psoriatic arthritis, and hives, and scalp psoriasis. So your body sounds like it's pretty inflamed. Typically, for the leaky gut, I tell people to have the luminosity. So there's leaky gut herbs in there to help with restoring that small intestine, and there are a couple of anti-inflammatory herbs in there. But is that strong enough, for what you're dealing with? These are pretty big illnesses, and hives are easy to get rid of. It could be, the hives could be from stress as well. What you're going through, your body's going, you're 10 months postpartum as well, so your hormones are still readjusting. There's a lot of things going on. So yes, I've got patients in New South Wales and Queensland. I just send you out the herbs and whatever other supplements. We just do a Zoom consult like today, and then I just send you out everything. The only thing is I don't do acupuncture, but when the skin is pretty inflamed, I sometimes don't do acupuncture anyway, because people have that skin sensitivity. But definitely we can move forward with doing a consultation. But I think there's a lot of factors going on there, and you could try the luminosity if you wanted. Definitely soak your body in the salt water, the Celtic sea salt or the Himalayan pink salt. But really, we've got to fix the inside environment to get that resolution. There is, for the scalp psoriasis, there is the three. It's called the triple. What's it called? The triple threat scalp pack. And the objective of that was because of someone who's had scalp psoriasis, right? So you always know these things when you experience it yourself. So the objective of that is the mask lifts the lesions off the scalp. And the reason why we're doing that, and sometimes hair can come out because obviously if it's strongly adhered onto the scalp and we're lifting it, the products, anti-inflammatory products, can't get into the inflamed site because of this like barrier of the psoriasis that's in the way. So the reason why the mask is there is actually helps with lifting that off. And then you have the non-greasy spray, which are basically botanical extracts that you would do in the day, so it doesn't make your hair oily. And then at night time you've got the enriched oils. But some people prefer to, it depends how much of the scalp is affected, but they prefer using the revitalizing scalp and body cream, because it kind of is the amalgamation of both the spray and the oils. But basically you could do the spray in the day, the oils at night, and you use the mask 2 to 3 times a week to try and lift that off. When you can lift it off, you can more effectively treat the inflammation in the skin. While that lesion's there, it's pretty hard to get into that. Yeah, I hope that's been helpful. But these diseases aren't easy to treat, that's for sure. But if you've got any questions, you're welcome, Melinda. If you've got any questions, please feel free to email me. I'm hugely passionate because, like I said before, I did a lot of seminars for practitioners because I want people to go to us because we have better answers than Western medicine. This is definitely not a us against them. It's just what resources we have and what resources they have. Yes, ours takes longer, but theirs takes longer too. It doesn't happen overnight. Biologics don't work. They take about a month. So, it's one of those things, if we can treat it properly to begin with, we can minimize the exacerbation of future flare-ups and the frequency of them. So that's really the objective. But thank you for joining me today. It was great to have you, and I hope you found it beneficial. And like I said, reach out. I think that's my details there. I probably should have put them up. So you can ring me in the clinic, you can email me. If you want to book online, Melinda, you can, or you can ring me or email me, whatever's easy. And you can join us on Facebook. I try and put stuff up on occasion. Although, disclaimer, I'm not the greatest in regularity, but I try and put some stuff up. So again, thank you for joining me, and hope all is well, and I'll speak to you soon. Bye.